You know, there are so many headlines and so much information out there right now about the coronavirus, and it can be hard to break down. So joining us now is Dr. Kiri Brandy, who is a general surgeon for St. Lawrence Surgery, who works at Claxton Hepburn River Hospital in St. Lawrence Health Systems. Thank you so much for joining us today.
Oh, thank you. Thank you for having me.
Okay, so you're going to help us break this down a little bit. I think we should probably start with what the coronavirus is and how it's different from like the normal flu.
Okay. So the coronavirus, the name of it is SARS CoV-2. That's the name of the virus. And the disease you get is COVID-19. And it's different from the flu that we see seasonal in this area because a few reasons. Well, we don't have anything against it. So when people talk about the flu, you get your flu shot. Some people start getting, flu symptoms in September, October, and they see people up until March. That's a seasonal thing. So not everybody gets it at once. We have a shot against the normal flu that sometimes works, sometimes doesn't, but it helps like not everybody get it at once. And then if you get the flu, we have medicines like Tamiflu that can help like dull the symptoms and stuff like that. So we have many agents against the flu. It's been around for a while. The coronavirus is a novel virus, meaning that it's new. So people's immune systems haven't seen it before. So it's very contagious, and everybody is getting it because we have no immunity against it. There's also no current vaccines against it. There are some that they are trialing and waiting for some FDA approval and testing and things, but we have no vaccines currently against it, nor do we have any medications that we know work against it. There are a lot of talk on the internet of different anti-malarial medications and antibiotics, and there are tales of them working, but we don't have any controlled studies that say for sure they work.
Okay, so the next thing is, speaking of all that, is that there seems to be a lack of tests. We're seeing this in headlines a lot. So how do we know if we have the coronavirus, if we should get a test, and if we go to the doctors to get a test, if they're going to even have one for us?
So that was kind of the problem early on. I think that all the health systems in Jefferson County and St. Lawrence County are kind of in the same boat, is that we just didn't get a lot of tests. The tests were given out by the government, and in the beginning, there just weren't a lot of tests. So it's not that these health systems don't want to test you, there just wasn't the test in the beginning. I think that a lot of the kind of hype in the media and a lot of people like sending messages to like Governor Cuomo and things like that. Certainly we are seeing that change a little bit now that the government has gotten some of the private sectors involved with making additional testing. But we certainly don't have the number of tests that we need yet. So you're right. We definitely do not have enough tests yet, but we're hoping that improves with time.
So when should you go to the doctors if you think, like, what are the symptoms that would require you to think maybe I should go and try to get a test or at least talk to somebody about that?
So right now, what a lot of the hospitals are doing is that typically the initial symptoms that we are seeing are fever, and that's fever of over 99 or over 100, and cough. So if you are experiencing fever or high fevers or coughs, or a change in your respiratory symptoms, there are hotlines that you can call at all of the hospitals. And those hotlines are usually answered by nurses or are people that have the medical expertise to help you understand when you should come in and get tested and when you should come to the hospital. Because we're actually trying to prevent people from coming through the emergency room for their testing.
Okay, so the next thing is whenever we're talking about something that can actually, they're talking about deaths a lot in the media right now, and that can be super scary with anything, and especially with something like this that's unknown. So what are the chances of somebody recovering from this? And then how do you know you're recovered, and when can they come around other people again?
So right now, here in the North Country, we don't have a lot of like hospitalized cases that we have a lot of data on the recovery of them. But we do know that the disease acts a lot like a disease we already do treat, and that's called ARDS, which is a disease that affects the lungs and makes your lungs almost like they're underwater. They can't expand as well. So we're utilizing our treatments that we've previously used on ARDS to help us understand what things we can do to people in the hospital to get them over the COVID virus also. In terms of, we still don't know a lot. Everybody's different in terms of, if you make it to the hospital, you have like you're sicker with the disease, and there's a lot of other organ systems that can be affected. So I certainly will leave the recovery of that up to an individual, like, kind of case, and the doctors to determine when people are recovered. We have not seen that up here in the North Country because we don't have a lot of active cases yet, and we know that kind of the timeline is, like, in terms of, people are usually sick with the symptoms, the severe symptoms, up to about 14 days. The at-home people, the people with milder symptoms, they typically recover on their own at home without any medical help. What the things that they need to look out for is their breathing. So if they are having increasing tightness in their chest or difficulty breathing, that would indicate that they're not doing as well at home, and that they may need to come into the hospital, so they're not recovered. But typically people get over this virus with no support. From 80% of the people have a mild case, and they can recover from it at home. Obviously social distancing and trying to stay away from their family members. And we're encouraging them to do things that they would normally do for, like, the flu or viruses, drink lots of water, take lots of supplements like vitamin C and zinc, and making sure that they're eating and washing their hands. And we know that as they recover around that, 14-day mark, what the guidelines, and these are by the CDC, is that they have to be symptom or fever free or symptom free for 72 hours before they can kind of go back out into the workforce, and symptom or disease 7 days from their first symptom that they experience, whether that be a cough or a fever, or something like that. There was some talk of having 2 negative tests, but I think that's really hard to do because the turnaround time up here in the North Country is still, days. And so to think that you're going to have 2 negative tests within 24 hours, it could take a long time for those tests to come back.
Great. Now, you mentioned, obviously, we don't have a ton of cases here in the North Country yet, perhaps in part to the fact that it takes, a few days for the test to turn around. But obviously, we're expecting that number to increase. And you work at local hospitals. So what are some of our local hospitals doing to prepare for those numbers to increase?
Okay. So as of last week, and this is kind of all under the guidelines of Governor Cuomo and Public Health and the Department of Health, we were asked as hospitals, so all of the hospitals in Jefferson County and St. Lawrence County were asked to stop doing elective cases and elective procedures, and really limit the things that we did to more emergent procedures. And the reason for that was to increase our hospital utility or utilization by 50% to 100%. So what we're trying to do is, if we were to see like the type of surge of cases like New York City, or if we were to get some spillover from like Syracuse or those counties, we would have the capacity and the supplies to deal with those patients. So it may never come to be that, but the state is asking us to save our supplies and save our doctors and save our utilization for if we, need to increase our patients.
Well, Dr. Brandy, I can't thank you enough for taking the time to talk to us today. Really quick, one last thing before we go here. We're hearing the importance of social distancing over and over again. And, I hate to say it, but I am seeing, whether it's my own personal Snapchat or on social media, there's still a lot of folks that just aren't social distancing yet. So what can you do to stress the importance of this?
Well, I mean, I think, you know, New York City unfortunately couldn't social distance as well as we can in the North Country. You know, one of the benefits of being up here is we're not really on top of each other. We do have kind of the North Country, and we don't live as close together, and rely completely on public transportation. But we, like I said before, we have nothing against this virus. And all we can do is, you know, kind of stay at home and stay at home under the guidelines of the governor. The public health, the Department of Health, the governor will tell us when we're seeing the spike of the curve trend down, so that maybe that the cases aren't continuing to go up. But by social distancing, we're not allowing this virus to replicate as quickly. The problem with you know, New York City right now is they can't handle the number of people all getting this virus at the same time. And we can't either in the North Country, even though we don't have as many people, but we can handle people getting it slowly. So by social distancing, everybody won't be getting it at the same time.
All right. Well, thank you so much again for taking the time. I know that this is something that is, hopefully we can talk to you again about soon as we get more information. And we thank you for everything that you're doing on the front lines there.
You're welcome. Stay safe and stay healthy.
Thank you. Bye now.